Hi everyone, this is Carrie Dillon from class of 2019. In this video I'm going to talk to you about acid-base disorders. Very complicated subject with lots of concepts and lots of equations. We're going to go over some very basic steps that will help you solve most of your step 1 and your shelf questions. There's going to be a lot of information on these slides. I'm not going to cover everything that's on them in order to keep this video a little short for you. However, feel free to pause and study anything that you need to as we go along. What I put together is 3 steps, and these 3 steps will help you work through your acid-base disorder problems. The ranges that you see on this slide are based on the USMLE lab values. You might see other ranges depending on the study source you have, so just keep that in mind that sometimes they'll change. For every acid-base disorder question, you're going to have an arterial blood gas that they're going to provide to you. Your arterial blood gas is going to include a pH, a PCO2, and a PO2. And then in addition to that, they're also probably going to give you a bicarb and some of your electrolytes. So your first step on these problems is going to be to check your arterial pH. This is pretty straightforward. If you have a low pH, you can assume that you have acidemia. And if you have a high pH, you can assume you have alkalemia. And from there, your first thing is going to be to check your next thing is going to be to check your PCO2. While you're doing this, you're also going to check your bicarb because you want to make sure that you have proper compensation, in particular to see if you have a secondary disturbance on top of that primary disturbance. And that is something we're going to cover in a little bit here. This chart is a good overview of the trends you're going to see for your primary acidoses and your primary alkaloses. We're not going to go into each of these, but some helpful things that help you think about this is your PCO2 is going to go the opposite direction of the pH in any primary respiratory disorder, as you can see on the arrows that are here. It helps to think about it in an acid base that think of your PCO2 as your acid, and your bicarb is your base. So for example, with respiratory acidosis, if you have a low pH, so more acidic, you think about it that you are adding acid by adding the PCO2, and therefore that's leading to this acidic, or this acidosis. And vice versa with a primary metabolic disturbance, you're adding or subtracting your bicarb, which is your base. So for metabolic acidosis, where the pH is going down, it's becoming more acidic, you're taking away that base and therefore making it acidic. Once you determine your primary disturbance, you can move on to step 3, and we'll move back to step 2 in just a little bit here for compensation, but let's talk about step 3 first, which is check your anion gap with metabolic acidosis. I put in the parentheses and metabolic alkalosis. Anytime that because you want to make sure that you're having proper compensation, which once again we'll discuss. So this is your equation that you'll see here, and you probably already have this memorized, but in case you don't, one helpful way to think about this is if you think about your electrolytes, so your sodium and your potassium as your positives, and your chloride and your bicarb as your negatives, this is taking the big positive and subtracting all the negatives. And I added on there your normal anion gap ranges, and if you see anything above 12 when you calculate this, that is an increased anion gap. And as you probably already know, the reason that you're checking this anion gap is this is going to help determine what is actually causing this primary disturbance. So we talked about before, going back to step 2, as you are looking at your trends for your PCO2 and your bicarb, you want to make sure that compensation is working. Because if it's not, that means that you might have another disturbance on top of that primary one. The equations that are important to memorize here in particular is going to be this is your Winter's formula for metabolic acidosis. And this is the one you want to have this memorized in particular. The respiratory, you can take a look at those as well and kind of try and remember those trends as much as you can. And that's going to be important to determine whether the patient in the vignette is compensating properly for this disturbance. Because if they're not, you can assume that they most likely have an underlying secondary disturbance along with the primary one. And your question might actually have you distinguish between those two. That might be one of the options on the answers is a primary metabolic with a secondary something, for example. From those equations and finding out if you have respiratory acidosis or alkalosis, etc., you cannot just from those numbers know your diagnosis. So your vignette's going to give you some other information about the patient so that you can actually determine the diagnosis. They might ask for that directly in the question stem, or you might just be required to know that to understand for treatment options. So this slide is pretty comprehensive on the most common of the different diseases that you might encounter based on the primary disturbance. The respiratory alkalosis and acidosis are pretty straightforward. So for respiratory acidosis, they're hypoventilating. So they are not blowing off that CO2 in an efficient enough manner. For respiratory alkalosis, they're hyperventilating, they're blowing up the CO2 quickly, and therefore increasing their pH. The bottom left corner with metabolic acidosis, this is broken up into MUD piles, which you probably know that acronym is your elevated anion gap, and then HARDAS is an acronym for your normal anion gap. We'll have another slide that's going to talk a little bit more about those. And then for metabolic alkalosis, something helpful to remember is that it can be due to volume responsive. It can be volume responsive or volume unresponsive. And if they provide you with a urine chloride, that can kind of help you determine which one it is. So if the urine chloride's below 20, you can assume it's probably a volume responsive primary disturbance. And you'll notice that salicylates is listed twice on here because you're going to see a primary disturbance along with a secondary one. This is an important one to talk about because the boards like to test on this. If you see a normal pH but also have a decreased PCO2 and a decreased bicarb, then you could assume that your patient in the vignette has overdosed on salicylates. So that's a good one to keep in mind that you might be tested on. As I talked about, the one that I want to cover a little bit more is the metabolic acidosis with a normal anion gap. So there's a lot of them here. You can memorize this acronym if you want to, but the two big ones is the renal tubular acidosis and diarrhea. And because those are the two most common ones that you're going to see on the questions that they might give you. One way to distinguish between the two of these, if you can't tell already from the vignette and the clinical stuff that they're giving you, is looking at your urine anion gap. So if they do provide that, you can use those to determine between these two. Really simple equation. You just take your urine sodium and subtract your urine chloride. If that is a positive number, then you have renal tubular acidosis. And if not, if it's a negative number, then your patient most likely has metabolic acidosis due to diarrhea. This last slide that I have here is just kind of a summary of the different steps you want to take. So we talked about determining your pH, and from there you can use your PCO2 along with your bicarb to see your primary disturbance, and also looking for compensation to see if you have a secondary disturbance on top of that. As we discussed, if you have a metabolic disturbance, whether it is acidosis or alkalosis, just to make sure you're checking for compensation, you're going to check your anion gap. And from the numbers that you're getting from those, you can determine what your primary disturbance is and therefore be able to find your diagnosis. Thank you, everyone, and have a wonderful day.